Many patients have had this kind of psychological suffering before they make up their mind to have surgery. If the surgery is unsuccessful, not to mention the tens of thousands of dollars in treatment costs, the bad thing is that their original joints have been cut off, and the man-made joints have not been properly installed. So how can they live their lives in the future? If they do not choose the surgery, the pain symptoms are very serious. Taking Chinese and Western medicines, physical therapy, external creams, massage, acupuncture and other treatments have no obvious effect, is really affecting the activities and life, in the end, to do or not to do. In fact, surgery can be considered when one of the following conditions is met. First, severe pain, which has not improved after trying various internal conservative treatments. Second, impaired mobility, such as walking and going up and down steps. Even walking 500 meters is difficult. Third, joint deformity, such as ankylosing spondylitis, rheumatoid arthritis patient's hip flexion contracture deformity, affecting the patient's daily life. In addition to the above, doctors will also consider some other factors, such as age and the patient's health condition, etc. Whether or not there are diseases in the internal medicine system, such as high blood pressure, heart disease, diabetes, lung disease, etc., is also one of the factors for doctors to judge whether or not to operate.